Welcome back to the program. And in case you're just joining us, you are just in time for the second conversation we had lined up for you as we switch gears and get into matters health. Every Wednesday here on Daybreak, we usually take time to focus on health and lifestyle. And today being the month that we create awareness on cervical cancer, we have dedicated it just to talk about cervical cancer and to help you understand how you can be able to prevent in case you are not part of the statistic, and how you can be able to fight better in case you are already, you've been diagnosed to have this form of cancer. And that is why in studio, we have with us a cervical cancer warrior, a survivor who are actually, she has just informed me that she has survived 2 types of cancers. Her name is Praxidis Anyango. Thank you so much for creating time for us.
Thank you so much.
And we have with us Dr. Eli Odongo, a gynecological oncologist and also a lecturer at Kenyatta University. Thank you for creating time.
Thank you.
All right, so today, it's actually not today, the entire month is dedicated to create awareness on cervical cancer. And this is the type of cancer that has been described as the 4th most common cancer in women globally. But let's begin from the basics, Dr. to get to understand what this is when we talk about cervical cancer. It's all about awareness. Let's not assume that everybody knows what cervical cancer is. Let's start there.
Thank you, Safin, for having me in the studio. This is Cervical Cancer Awareness Month, whereby we are involved in spreading the message that cervical cancer is preventable. So before we delve into the discussions today, we have to understand what we are talking about. What is the cervix? Now, the uterus is divided into 2 portions, whereby you have got the body, where the baby holds the baby, and you have got the lower portion of the uterus that is called the cervix. It's around 4 centimeters in length, and when you do what we call a pelvic examination, whereby you insert something we call a speculum, that's what comes into view when you do that. And that's the portion known as the cervix. And it's what dilates when someone is in labor. You hear you're 4 centimeters, 5 centimeters. So it's that portion of the uterus that dilates. It's pretty small, 4 centimeters, but it has significant of importance in the reproductive life of the woman. So it is the part that gets, maybe these questions will come later, but just to mention that that's the part that when it gets affected by malignancy, that is a cancer, we refer to that as cervical cancer, when a cancer occurs in the portion that I've just described.
How common is it?
Yeah, cervical cancer is quite common. We already mentioned the statistics. Worldwide, we are looking at least 500,000 to 600,000 new diagnoses, with half of that mortality, I mean deaths, around 300,000. But we come down to Kenya, the diagnosis, the new cases, that is around 6,000. New cases or thereabouts.
Is it annually?
Yes, annual. This is annual, yeah. Okay. This is annual data. And out of this, mortality, meaning the number of deaths from cervical cancer, is around 3,200 per year. Which means that we are bearing the brunt of the disease, especially in the developing world. Much as we've quoted the big numbers, most of it is in the low and middle-income countries.
And we'll talk about that later, what could be the underlying factor, because reports indicate that the developing countries actually bear the biggest burden of the cases that are reported and even the deaths that are reported because of cancer. But something that is quite unique with the numbers, Dr. is that we lose almost half of the cases. Is there something we should read from this trend? Like in Kenya, 6,000, the deaths are 3,000. The global numbers are over 600,000. The deaths are at 300 and something thousand, losing almost half. Could there be something we should read from this as well?
Yeah, and that's an area of concern, because cervical cancer is now a public health problem. And having realized that we are having so many mortalities arising from cervical cancer, the World Health Organization in 2020 came up with a strategy of prevention of cervical cancer. It's what is abbreviated as the 90-70-90 cascade or the 90-70-90 strategy. These are just percentages. So the first 90 means that to have our girls vaccinated by the age of 15 years, 90% of the girls vaccinated again by the age of 15 years, and you realize in developing world this is quite low. The second bit, that is the 70%, is to have the women screened with a high performance test. In this case, human papillomavirus DNA screening. We also realize this is really not very widespread in the developing world. And also the last 90 is those women who are diagnosed with cervical cancer or pre-malignant condition. What I mean by pre-malignant is that cervical cancer takes a long time before you actually, from pre-cancer stage to cancer stage. So any woman who is diagnosed at the pre-cancer stage or cancer stage are linked to appropriate care, including palliative care. And we in developing world or in the low and middle income countries, we are still lagging behind in the 90-70-90 cascade as recommended by the World Health Organization.
All right. Thank you for saying that, because I want to understand a lot more in terms of the vaccination, what options are there, and in terms of even the treatment options, and why we seem not to be really taking advantage of these opportunities in our side of the world. But let's also get to hear a little bit about Praxedis Anyango. And for you, these are not just numbers. You relate at a very close range because you are diagnosed with the very cancer we are talking about. But just to get to understand a little bit about who you are, tell us a bit about your story.
Thank you so much, Safin, for the opportunity. My story. As you said, my name is Praxedis Wandera Anyango. And my story began in 2019 when I started having some discharge, which was very minimal. It was not a lot. And it went on. Then at some point, I decided to go to hospital because it was becoming persistent. And then, of course, I was put on antibiotics. So I lived on antibiotics for almost 2 years, 2019 and 2020. Part of 2019 and 2020 and now into 2021. So when the discharge became, it kept on increasing with time. And I was like, I needed to seek, serious medical attention.
So despite the antibiotics?
Yes.
The discharge still increased?
Yes, it increased. And so at our workplace, they gave us an opportunity through the insurance to go and do a pap smear. So in 2020, towards the end of the year, I went for a pap smear. Then when I was being tested, I bled. So I asked the nurse and the doctor, do you think this is going to give us good results? Because what I'm meant to understand is that pap smear, you don't have to bleed. And doctor can attest to that. So they were like, no, it will be okay. Let's just take the specimen to the laboratory, and then we will advise after we get the results. And then I was like, okay. So the results came, and then they told me that I'm okay. So I asked, can we try again since I bled? And then they were like, we can do it again. So they took again a specimen.
It was you insisting?
Yes. Okay. And again, I bled. So when the results came, they told me I'm okay. And that was the second pap smear. I wasn't curious maybe because of lack of knowledge. So I went back home. And after that, the discharge continued. So in 2020, 21, I had traveled for some work, although within the country. So when I was in the field, I started like having some funny smell with the discharge. Then I was like, you know, this is something that is really getting serious. So when I got back to town, immediately I went to hospital. And then after that, I was advised to see a gyna who was coming 2 days after the day I was in the hospital. So I went back after 2 days. Then the gyna who saw me told me that we need to do like a physical examination of your cervix and see what is exactly happening. So when she did that, she even got shocked. Because the moment she put, you know,
Speculum.
yes, the speculum, I bled like profusely. And, you know, she was shocked and she told me, Praxidis, you have a very big growth. And she was like, this is so urgent. I don't know if it's cancerous, but we need to do more tests so that we can get to understand how we can be able to handle this. So immediately she referred me to the main hospital, which is Aga Khan, and I went there. Then, of course, the biopsy was done. Then the results came out 2 weeks later, and it was confirmed that I have cervical cancer stage 3C. Yes.
So this was like after how long since you started feeling like something was off with your system? From 2019 to what time?
Yes, from 2019 is when I started having these discharges, and it wasn't so severe. So, you know, the way you go to hospital, you're told that it's an infection. That is how I lived for 2 years. And it reached a point I could not even go out without a sanitary towel because it was a lot. And I think I walked around with sanitary towels for over a year just to protect myself. I can't go out with, you know.
Without it?
Yeah, without it.
All right. I'll come back to you just to get to hear more about your experiences and even receiving this news. It's not a very easy news to absorb for any person.
Yeah.
But Daktari, having followed, you know, her story, what are your concerns about how this case was probably managed? Because from 2019 to how many years later did you get your diagnosis?
After 2 years.
After 2 years.
Yes.
Yeah. And with cancer, they say the earlier you catch it, the better.
Yeah, I've followed through the history that she's given, and this is typical in most of the women who come to see us.
Yeah.
I'll tie this with how does cervical cancer present. The common presentations include postcoital bleeding. Postcoital bleeding means bleeding after sexual contact. Then we have intermenstrual bleeding. This means bleeding in between periods, and one completely loses cannot tell the cycles.
Yeah.
Then we also have abnormal vaginal discharge that is not responding to conventional antibiotics or treatment. And this discharge is usually initially watery. Later on it becomes, of course, stained either with blood or because of the infection you can see a bit of pus. And of course develops foul smell. Foul smell because the tumor is kind of sloughing off and so giving that presentation. So the concern here is, why are our women coming late? First, I want to relate to your story of having had a pap smear and still reported as normal.
Yes.
Pap smear is a screening test. Screening in that you want to get women without disease. It's now obvious, it's now been shown that pap smear can miss cancer, obvious cancer, invasive disease, by up to 50%.
Oh, okay.
So pap smear is a screening test, and a screening test is for, like I keep repeating this, for a symptomatic individual, meaning they don't have symptoms. But once you do a speculum examination, the way you see that tumor, And I'll just describe to the viewer what a speculum is. A speculum is an instrument that we use to examine the genital tract. It opens up like the beak of a bird, and you are able to visualize what is inside in the vagina.
Okay.
Once you encounter the tumor, it's recommended that you obtain a tissue biopsy. Tissue biopsy means you obtain a small specimen, and then this you submit to the pathologist to examine, to confirm whether it is, to confirm whether it's a cancer or not. So just to reiterate again, PAP is a screening test. And so women who present with postcoital bleeding, abnormal vaginal discharge, intermenstrual bleeding, some even progress to pelvic pain, pain in the, sometimes pain radiating to the leg, bowel disturbance, depending on the stage of the disease, there needs to be looked into with concern.
Biopsy.
Yeah, and once you see a tissue, an obvious tumor, it's recommended that you take a biopsy, don't do a PAP at that time.
Yeah. So that could be why probably it took longer than necessary to get a diagnosis. Maybe at this point it would be important also to tell us what causes it.
Yeah, over 90% of cervical cancer is caused by an infection. The infection is a viral infection known as human papillomavirus, abbreviated as HPV for purposes of this discussion. There are over 100 types of human papillomavirus. But those that cause cervical cancer are the high-risk types, and there are not so many. So I may just mention a few types. We have got type 16 and 18, responsible for a big number of the cancers that we see, but we also have other high-risk types. So having mentioned the causative agent, it is important to know how to, what puts you towards the path of getting cervical cancer. So any condition that predisposes to acquisition of human papillomavirus. Let it be known to viewers that even one single sexual exposure is enough for one to acquire the human papilloma virus, because we've also seen these changes in very young girls. But we have issues to do with multiple sexual partners. Other core factors like smoking, being immunosuppressed. Being immunosuppressed means, one, if you have HIV, or you're undergoing organ transplant, or chemotherapy, or immunosuppression because of one reason or another that predisposes to persistence of the disease. Now that I've mentioned persistence, allow me to dispense with this. Most women will still get HPV. The reason why some develop cancer is because the disease persists. Most women will clear the human papillomavirus within 1 year or to 2 years.
That was the question I wanted to ask you. Because I read somewhere that any person who is sexually active is prone to acquiring the human papillomavirus.
That's right.
Should we be concerned? That was the question, but that is where you were going.
Yes. Yeah, the issue is persistence. Okay. Because as long as the immune system is good, over 90% of women will clear the disease within 1 or 2 years because the immune system will fight it. However, if there is one reason or another, you have, let's say, HIV, that's why we are seeing many more cervical cancer cases among the HIV infected, mainly because of immunosuppression. They're not able to clear the disease.
All right.
Yeah.
I'll ask you this for 1,000 others. So do you mean that people should not have sexual encounters because it's a risk? Just to clear that.
I don't want to, I'm not a social scientist, so personally, I would, men will always reproduce. Men will populate, to reproduce is a command, I think, from, if you read the good book. And the way to reproduce, we know what it means. One must have sexual contact. And sex has been described in many texts and the Holy Book, among the reason, I mean, the need and the importance of sex in relationships. So I wouldn't prescribe that no sex for people not to get HPV.
Okay, you had that. So back to you, Praxidis. So it's 2 years down the line and you get that confirmation on actually what has been bothering you from 2019, and finally you're told it's confirmed that it is cancer. How are you receiving this news? What is your state of mind? What is happening around you? Just take me to that moment.
Wow. I think I'll go back to the point when the gyna noticed that I have a very big growth. And when she said that you have a very big growth, and I don't know if it's cancerous. I don't know why I picked that word cancer. And at that point, I lost it. I broke down and I couldn't even manage myself. So, of course, I had to call in a few friends who came and took me home. And after now, when I went and the biopsy was done, then I was called in for the results. Of course, it wasn't easy. It wasn't easy because, of course, of the things I've had. Leave alone the chemos, leave alone maybe the pains that
What are those things you had? Because there are people who, the very things you had before, at least now you know better.
Yes.
Those are the things they know now. And that's why we are having this conversation, to clear the air and to create awareness.
So, of
what
course,
are the things you knew?
Yes. Then? So the things I knew then is that cancer is a sentence to death. That is what I knew then. What also I knew is that cancer treatment is very expensive. Yes, it is. And at that time, I was concerned because I have kids. I am a widow. I'm like, who am I going to leave my kids with? Because mentally, I'm like, this is the end of it. Of course, the stigma, you know, and even today, I will tell you that in many of our cultures today, people are perceive cancer as, you know, witchcraft. Women are even blamed, you know, in some instances for having contracted this disease. It is not their fault. So all this go through your mind. Of course, you get confused, you get concerned, you get anxious and all that. So for me, when I was told that it's positive and it's stage 3C, I was like, this is quite advanced. And I will not mention names, but one of the things that I felt at that point is that the hospital at which I did my pap smear failed me. Because with the 2 pap smears, I was bleeding. If they were keen enough, maybe that could have been averted. It wouldn't have been discovered at stage 3C. Maybe it should have been at stage 1, which is very easy to manage. So those are some of the things that were going through my mind. And I felt like, you know, maybe things could have been done better. Because I took the initiative myself and went to hospital early. Yeah, so I would add that I think what needs to be done is for us to avoid going through these serious treatments, which are very expensive, is that hospitals or our health practitioners, they need to be empowered, especially our nurses who do these tests. They need to understand that what should they look out for if I come to a facility and I want to be tested of HPV. What are some of the things that I need to look out for? I know Doc has mentioned some of these things, but they need to understand from their own, you know, perspective also, that they can be able to look out for A, B, C, D. If it's a pap smear, if somebody bleeds, that is a sign.
All right.
Check it out.
All right.
Yeah.
It's important you've said that, Praxidis, and I'll come back to you to tell me how you turned from a patient to a survivor, because that is also another phase 2 of this whole story, is actually just bracing yourself for that particular fight against cancer. But Daktari, what you pick from her narrative, we've had these cases before. She's lucky. She's one of those who empowered Kenyans who go to hospital to find out, what is wrong with them. There are thousands others who would not even go to the hospital. They'll wait until the very last minute when it's bad, bad, bad. When they can't take it anymore, that's when they go. Talk to us about the importance of detecting this early. She said it was stage 3.
3C, yeah.
Yeah, just run us through the very stages and what makes one stage easier to manage as compared to the other, and how to catch it early, and what are the options for those who may not even have ever had. We have women who have never had a pap smear in their lives. Yeah? So talk to us about that as well.
Yeah, I will take us through the stages. I'm trying to simplify it so as not to sound that in a medical school lecture. Cervical cancer is one of the cancers that is clinical stage. By clinical stage, I mean you can, by examination, you determine the size of the tumor and the appearance. And also there are additional imaging studies that you can do to help you do the staging and tie it together. So I'll walk us through stage by stage. It's mainly stage 1 to 4. Stage 1 has 2, A and B. Stage 1A is just, we call it a microscopic disease, means you cannot see it with the naked eye when you do the speculum. That means that requires a biopsy. Biopsy means taking a tissue, so the pathologist report to you that it is stage 1A is microscopic disease. But 1B is macroscopic, means that once you examine the cervix, you can now see an obvious lesion or an obvious tumor. Further subdivided into B1, B2, B3, depending on the size of the tumor. And then stage 2, of course, it has spread to the vagina. And then stage 3 is further subdivided into 3A, maybe lower third of vagina. 3B, a little bit spread towards the other parts of the pelvis, sometimes blocking the passage of urine from the kidney. We call that one hydronephrosis. Or 3C. 3C means that it has involved the lymph nodes. Lymph nodes are kind of the filters of maybe infections, tumor cells, and all that. So we know that cancer spreads either through the blood or through the lymph nodes. So once you see that the lymph nodes are involved, that's when it becomes stage 3C. And of course, stage 4 could mean you're involving other organs in the pelvis, or it has gone further to other places, like other parts of the body and other organs. And the treatment of each stage is different. It also takes into account the fertility desires of the women, because we are now seeing younger women with cervical cancer, and they may still want to take the journey towards motherhood. So you can tailor the care accordingly. For example, if one has stage 1, you can just remove that part of the cervix that has disease. We call that medically trachelectomy. But remember, when we were beginning the show, is that the cervix has its role in labor. So when you do such a procedure, then you're supposed to protect the uterus from losing pregnancies by putting a purse string where the cervix was. This I'm talking to women who may still want to preserve fertility.
They have stage 1 cancer, but they still want to have
preserve. Children. Yeah, they want to have children. You can remove that part of the cervix. Even stage 1B, you can still do that.
But the option is only available for the early stages of cancer?
Yes. So for early stages of cancer, because once you start going to advanced stage, let's stage bigger tumors or stage 2, then you go towards radical surgeries. By radical surgery, I mean you're not just removing the uterus. You remove the uterus with its supports, because the uterus has supports. You remove a big chunk, a big length of the vagina, because you're trying to address the margins. And then you also look for the lymph nodes, because it also helps you to do the staging. But once the disease is beyond surgical options, it's important to now go towards other modalities of treatment, which include radiation and chemotherapy. The chemotherapy being given maybe once a week and radiation for 5 days. And I keep insisting that radiation must be completed. For people who don't understand, maybe just to break down what radiation is, there are special rays, special X-rays that ionizing have an effect on treatment in terms of damaging the DNA of the cell so that it's not able to reproduce. And you have to have both external beam radiation, meaning it's radiated from outside the body, and it kind of addresses the spread of the disease.
So it kind of destroys the cancer cells?
Yes, destroys the cancer cells. Okay. And then you also must undergo what we call intracavitary radiation, also known as brachytherapy, meaning you are putting radiation very near to where the tumor is, where you give it through the vagina. Mm-hmm. Okay. And the radiation is given with intent to cure. When the disease is a bit advanced, we now have advancement in management of cervical cancer, and we are seeing a lot of improvement, especially with targeted treatment. Targeted treatment and immunotherapy. Let me just break it down a bit. Mm-hmm. Targeted treatment is that you give agents that target particular growth factors in the tumor. Mm-hmm. So there are some drugs that have been approved for use in this manner. And you also have other drugs that help in help the immune system fight the cancer. So in a nutshell, I've tried to break it down.
Yeah, from stage 4 and the
stage 4 and the treatment options.
What is possible at what level and what is not possible. We'll keep revisiting just for clarity. Yeah. But this is a journey that you really relate with. You've gone through some of these procedures. But before we get to what you really went through after you got your diagnosis, you're also a lung cancer survivor?
Yes.
Tell us about that.
So after the cervical cancer journey, of course, you're on remission, and you have to go for reviews every time. And I know Doc is mentioning some of these things, and it's not easy. Mm-hmm. So when I was going for my review a year later, and the doctor advised me to go for a PET scan, which now is it's like a complete body scanning. So they saw that it was in 2021 November. Mm-hmm. So they saw a small lesion in my lung, which was about 5 mm. And okay, it didn't occur to us that it was something that we needed to get concerned about. So a year later, again, I go for a PET scan. And then, because after treatment, there's a lot of side effects, of course. A lot of side effects, like there's just a lot of, like for me, I transitioned to menopause automatically. My legs are numb even up to now. Mm-hmm. So you continue going to the hospital for checkups. So another year later, and then I go for a PET scan, and then it is discovered that this lesion has, grown around 4 times. And the doctor was like, this is something that we need to check out and see what's happening. So I'm taken in for a CT-directed biopsy. And then again, the results come out, and it's cancerous. Mm-hmm. That is a point when you start asking yourself, why all this?
Why me?
Oh, yes, why me and all that. But one thing that I have really been able to appreciate through this journey is that you need to be positive. Mm. Positiveness really helps. I remember when I worked in my doctor's office the first time, she told me that Praxidis, we treat, but God heals. Mm-hmm. And I think that has led me through this journey, just to believe that, as much as the doctors are doing their work, it is God who heals. And he uses these doctors, for us to get better. So that second time really hit me again. And I was like, I'm not ready to go through the treatment because
Did they explain to you whether was it a mere coincidence or was there a correlation of some sort?
Yeah, so after I went through surgery last year, October, and the growth was removed. And then, of course, they had to do more tests and just to verify if it was a spread, either from the cervix or it's something new. Fortunate enough, it was a spread, which makes it more easy to manage, doc. And now I'm again on remission for the next, again, 2 years. So it was a spread. It was not something new, which could have meant a lot of, tests and all that, and maybe a different type of medication and all that. So I decided to go for surgery because radiation now with my chest could have been an issue. The doctors told me that I could develop some side effects of pneumonia because of the radiation. So I was like, I can't go for that. That is when I decided to go for surgery. But through the whole journey, I know Doc was mentioning about how do we, your question about how do we now make sure that, women don't reach those stages. I know maybe, okay, for me, I think we need also to start considering as a country to vaccinate our young boys, Doc, because if it's men who are the carriers of HPV, why should we be focusing just on women, yet we can maybe contain this at that point by vaccinating our young men, And also, for women, sexual intercourse is something that we cannot run away from. As Doc said, we are supposed to procreate, and that is the only way we can do that. Why can't we, like, for example, like women who want to, get into marriage, maybe with your partner, as people go to test for HIV, can men also be tested for HPV before they get into marriage? Then maybe, to some extent, this can also be able to help us to contain this disease from spreading.
All right.
Yes.
All right, Praxidis, as I'll come back to you, but Dr. What do you think about those options, even as you talk to us about prevention and vaccination and the status in our country today? There's that option of vaccination, but many people don't know about it, or they're not taking advantage of it. But also, first of all, just respond to some of the proposals she's putting on the table, like vaccinating the men.
Yeah, I think I want to correct the notion that it is the men who are the carriers of the HPV. HPV is found in all men and women. The prevalence of HPV in developed world is around 15%. The prevalence in East Africa is around 30%. So we've got many more cases of HPV. So the vaccination programs are important in preventing the cervical cancer, in that despite having had a lot of challenges with vaccination programs in this country, we still have a kind of uptake that is being, acceptance of the vaccine, though it is getting very slow traction. I'm trying to respond also to her concerns about vaccinating boys. It's an issue of economics, because the ones who are affected by the cervical cancer are the women, and they have the cervix. So where would you put your resources? I think you'd put your resources where it matters most, especially in this part of the world whereby resources are a challenge. So that's why we recommend vaccination of girls. However, in other parts of the world, I know where they have eliminated cervical cancer. I'll give examples of Australia, North America. They're vaccinating both boys and girls. And the reason is, first to achieve what we call herd immunity against the HPV. Because HPV is not just responsible for cervical cancer. There are other cancers associated with HPV, and there are a kind of benefits of vaccination, like some oropharyngeal cancers, some anorectal cancers associated with HPV. So it is important to have the vaccination. at the risk of maybe digressing, the Ministry of Health is implementing a vaccination program for girls. And in the Ministry of Health program, we are using the vaccine that has the 4 types of that protects against the 4 types of HPV, 6, 11, 16, and 18. The FDA approval for these vaccines, for that vaccine is up to 26 years, but can be given up to 45 years. The effect is more when the vaccine is given early, because the purpose of giving the vaccine is to generate antibodies against the disease.
So early in terms of age?
Exactly. Yeah, I mean early in terms of age, so you develop antibodies against the disease. But doesn't mean that older women up to 45 years cannot get the HPV vaccine.
All right. Just as you respond to that, earlier we were talking about the burden of cervical cancer, and we are looking at the incidences that have been reported and the mortality rates that are said to be very high in low and middle income countries. Over 90% of the 342,000 deaths occur in sub-Saharan Africa countries. What could be the indicators that make this happen? Yet we have prevention, we have treatment options. What is it? Are we lacking in those?
When the show was beginning, I talked about the 90-70-90 strategy, and we are lagging behind in all that. We are lagging behind in the vaccination programs because there's a lot of vaccine hesitancy, even in this country. And then we are also lagging behind in screening. The screening rates, I think, currently, I can't remember the latest statistics of Ministry of Health, but I don't think it's more than 20%, which means that most of our women are still not screened. Therefore, it follows that by the time they're presenting to a health facility, they have advanced disease. And when they present to the health facility with advanced disease, maybe the healthcare worker is not well empowered to know what to do. Like they still do a pap smear when there is an obvious tumor. So it's kind of a multifactorial. And then there's also access to treatment. Access to treatment is right from treating the pre-malignant condition before they develop into cancer. I know the path or the entry to treatment program is through screening. And if the screening is low, then you don't enter into the treatment program. And by the time you get the patient present with the symptoms, it's rather late. And so the outcome is affected by all these factors that I've tried to describe.
All right. Praxidis, as you take us back to your very own experience, many would want to know how you turned from being a patient to a survivor. And I know you know what I mean by this. There are people who are still patients. They've been given that diagnosis, but they're at a point of their very lowest, still do not know how to embrace this journey and fight cancer. What worked for you?
Okay, before I maybe touch on that, I just want to reiterate a point on the issue of screening and all that, and encourage women to go for screening. Although this December I was somewhere in my upcountry, and to be sincere, there is some dire need for sensitization and awareness. And at the same time, as we do this, and even encourage women to go for screening, as a country, we all know that treatment of cancer is very expensive. So you talk to people, you encourage them and tell them you need to go for screening. Somebody will look in you in the eye and say, it's better I die not knowing. Because even if I know now, how will I afford the treatment? Yeah. So I think what our government needs to do, I know Doc is talking about access to treatment. That is not enough. Is this, are we able to access it at the same time? How affordable is it? Because very many women are dying because of
I don't know. We've actually created a fund for, it's still a long way to go, but yeah, there's mention of, yes, as a country now we've created a fund for such chronic illnesses, disease, yes, yeah, because of that concern that you've mentioned. But allow me take you a bit fast. We've run out of time for this conversation. Yeah. So as part of your final words, you know, just encourage somebody who's watching you and that they could have gotten their diagnosis? How did Praxidis turn from what you were back then to who you are today, advocating and really, you know, inspiring people with your story?
Yeah, so of course the journey was not easy, and as I had mentioned before, is having a positive mindset, I think, is really necessary when you're going through these chronic diseases, when you're in that position. And everybody, like science says, like positiveness, you know, is like cure. Of course, when you go through the chemos, when you go through the radios, like I underwent like 25 sessions of radiotherapy. I had like 5 sessions of chemotherapy. I had 3 sessions of brachytherapy, as Doc had mentioned. And, you know, all this drains you. It really drains you. So I think for me, what really worked is that positiveness and the willingness to live. You know, you just want to stay strong, especially for the people who are looking up to you. The second thing I think for me was the support, the social support that I got. At that point, I know my daughter walked the journey with me through my treatment, and I had friends who could come over, encourage me, call me, pray with me, you know, and they really stood up, you know, and for me, and I think that is also another thing. And also, I think another thing I would say is I was really not stressed when it came to finances. I had an insurance that was able to take care of everything, you know. So that really also gave me the strength, you know, to stand firm and strong and to face all that.
Thank you.
So for me, I think one thing I can mention is I want to urge women. I know that it's expensive, but also today I want to request that if you are able to like register for NHIF, it is really helping women. You can be able to access some of these treatments through NHIF.
Thank you.
Yeah.
Dr. your final words.
Yeah, in this Cervical Cancer Month, let us talk about screening and treatment and of the pre-cancerous lesions. It will prevent us from from going down the path of developing overt cancer. I'd also like to thank the Ministry of Health for creating a very healthy policy environment. We have got very good policies in place for cervical cancer prevention under the National Cervical Cancer Program. Now we need to put in more resources to implement those policies.
Thank you so much for that, Dr. Eli Odongo, a gynecological oncologist and also a lecturer at Kenyatta University. We've been having this conversation with Praxidis Anyango, who is a cervical cancer warrior and also a lung cancer warrior. She has shared with us her story and how she was able to really embrace this very fight and become a warrior and a survivor from being a patient. And now you have it. Cancer is not a death sentence. There are options out there. You just need to get out there and find out what options are those. In case you're not part of the statistics yet, lucky for you, but you need to go get tested because you may just be part of that if you're not careful. The earlier it is detected, the better for you. And that is all I leave you with. My name is Safina Cheng Oma. Have a lovely day ahead. Thank you for watching Daybreak today.